Welcome back, everyone, to the CMN Radiothon here with Midwest Family Lacrosse, Static Electric, Mark Jewelers, and also we are live at Gunderson with the Miracle Team on the phone banks. Miracle Team, yay! All right, so if you want to make a call and make yourself a donation to the Children's Miracle Network, there is a team of Gunderson Medical Research Department that are taking your calls and taking your donations at 800-853-6889. Also, we have a friend with us today. We're talking with Carley Buisman. We were talking about some of the mispronouncing, how people tend to mispronounce your last name, and now I was thinking of one of the funny ones, and I didn't want to mess that up. So thank you. Carley she's the manager of the Integrated Center for Education, which is the ICE House. Can you tell us a little bit more about that, Carley?
Yeah, so the ICE House is our education center here at Gunderson Health System. We do education across the organization for certifying our staff, as well as education on sepsis, stroke, CPR, and we also do education for high school students as well. So,
and how does that work together with the Children's Miracle Network?
So the Children's Miracle Network actually donated a few of our mannequins. We have 2 currently from them that we've got in previous years. And we're getting 2 more that should be here any day.
And one of the things that we're talking about is, with some of the equipment that they use for the premature births and in the NIC unit.
Yes. So we do education in the NICU on how to resuscitate a baby if needed, how to intubate, how to put a nasal gastral tube in, a lot of different education that we can do. And actually today we have NRP, which is the Neonatal Resuscitation Program, actually happening in the ICE House today.
There is a lot of things that go into, and you have the experience as well, is a lot of things that go into a premature birth. And some of that is that specialized equipment, and some of that specialized equipment is pretty detailed and pretty expensive. And it's not, something that's easily affordable for most hospitals. And I mean, these units that is actually, there's one of them behind me, cost around $50,000. Mm-hmm. So obviously it's not an easy thing to just go, all right, we're going to go out and get one of those today. So thanks to programs like Children's Miracle Network, it makes it possible for you guys to use and have that equipment.
Yes. So in the past, before we had this donation from CMN, we used paper pictures of equipment and a baby doll, and now the education is just so much more realistic because our babies actually can move, their face moves, their arms move, we can place IVs, so the education is that much more real.
And you also have experience, again, like I mentioned. I mean, one thing that we have in common is that we both are parents of children that came a little early.
Yes.
Tell us a little bit more about that with your personal experiences.
Yeah, so I'm actually a mom of 2 NICU stays. So I had twins that were born 6 weeks early. They were only in the NICU for about a week. They just had birth issues and or birth weight issues and food intake. And then my youngest son, who was born almost 2 years ago now, he was in the NICU for 4 weeks. He was 4 weeks early, and he has a heart condition that we didn't know about until birth. His first week, we were very nervous that he wasn't going to make it. And so the education that I provide here at Gunderson, I got to see it in real life. Yes.
Firsthand.
Yeah.
And it is. It's, one of the things about that is, I mean, going through that process, you learn a great deal. Mm-hmm. For those who have never been through that process, there are a number of things that people don't necessarily understand when it comes with the parents that not all insurance plans cover. Mm-hmm. A lot of these things. Yes. The diapers are very, very small. They're very, very expensive. Sometimes you have extended stays with families mm-hmm. because they have a child in NICU. And with those stays, one of the things that CMN helps to provide is food and transportation costs, even gas and fuel costs, sometimes even hotel stays. So a number of the things that most people don't consider mm-hmm. That can actually help out families who are dealing with having a children that came prematurely.
Yeah, so CMN donated quite a few gift cards to my family when we were in the NICU for food, and it was greatly appreciated. We got coffee, we got breakfast, because me and my husband were here day in and day out. for both of their stays.
Right, and some of these things, I mean, the financials can really, really add up. And the funny thing, or not funny thing, but the weird thing is I mean, you're concerned about one thing and one thing only, and that is the health of your child.
Yes.
And the things that you don't necessarily take into account are the other things that you have to possibly worry about, that you can hopefully worry about later. Well, sometimes you don't have to worry about that, because those are some of the things that the Children's Miracle Network can provide, is helping out with those meals and those extended stays and those transportation costs, and even helping out with like the things that you work with the training and letting people know, how these things work, and better ways to care for those premature children.
Yes.
Is there anything else that you'd like to, ask that, or talk to about, people that, maybe don't understand how this equipment works, or what your ice house does?
I would just say that I wish healthcare and hospitals across the nation could have this equipment, because when you use equipment that's not realistic, the education is just not as beneficial. People can't take the education that they learn and take it to real practice if the education isn't realistic. And because of CMN here at Gunderson, we can do that, and we're so thankful because of it.
Very nice. Training is definitely key, and of course, the more the better you can care. So if you could make a donation to the Children's Miracle Network, it would be much appreciated, because much of this equipment is without, in a number of hospitals, it's out of their realm. But with donations from you and donations from the Children's Miracle Network, it makes it much more realistic, and makes that care that much better. So please make a donation at 1-800-853-6889. That again is 1-800-853-6889. Or you can text CMN Kids to 51555. That might be a slick and easy way to do it. It's like, everyone is on their phone most of the time, but don't tend to necessarily use your phone as a phone anymore. I'm guilty of it just like the rest of us. So sometimes just sending a text is one of the easiest ways to do it. Text CMN Kids with no spaces to 51555, and you can make a donation. Whether it be a one-time donation or whether it be a monthly gift, you can do it either way and help out the CMN area hospitals, along with, of course, Gunderson, because that's one of the greatest things about the Radiothon, is the fact all of this money stays local.
Yeah, please donate. The donations will be put to good use. Indeed,
and that's the best part. Again, all the money raised stays local. So please make those donations. CMN Kids, 51555. That's CMN Kids. Text CMN Kids to 51555. Or just make a call to our friendly neighborhood, all of our volunteers here taking the phone calls at 800-853-6889. That's 800-553-6889. I just got to talk about this thing again, because it's so little. Do you remember?
I do.
How old are your kids now?
So my oldest are 3. They'll be 4 in March, and then my youngest will be 2 on the 20th. And my twins wore diapers that small when they were born, and it was just mind blowing when I saw how tiny that they can be, especially as a first time mom.
Right.
It was, yeah.
Now, if you're watching the stream right now, obviously, if you're listening on the radio, you're not going to be able to see this. But if you're watching the stream right now, this diaper is about the size of my microphone. It's actually even almost smaller, and it brings back memories. And the nice thing is, they're good memories, because even though we went through that whole process of being frightened and scared and panicky and worried about the health of our children, we can look back at it now and just say, it's like, oh, I remember when he was that little, or I remember when she was that little. So it was a harrowing experience, of course, and there was all kinds of worries that came along with it, but now thankfully we can look back and with almost fondness, because of good training and because of good equipment, the professionals at our hospitals were able to get our children through it, and that's all we can ask for.
Yeah.
But the one thing I'm going to ask you guys for is money. So please make those donations at 1-800-853-6889. That's 1-800-853-6889. Or text CMN Kids to 51555. That's CMN Kids to 51555. 555. Also want to say a few thank yous again to our sponsors, Mark Jewelers and also Stanek Electric, Cooley Region Mobility, and also Team Marine Services, Oral Surgery of La Crosse, Ultra Federal Credit Union, and of course all of the people who are coming to join us today, including yourself, and all the people who are spending their time with us today to take those phone calls. That number again, 800-853-6889. That's 800-853-6889. Or CMN Kids, text CMN Kids, I should say, to 51555 and make your donations to the Children's Miracle Network of Hospitals. Tonight until 6 p.m. and tomorrow from 6 a.m. until 6 p.m. with Midwest Family and, of course, Mark Jewelers and Stanek Electric. And I want to say, thank you to you for coming along and sharing your story and sharing some of the things. Anything else that you would like to talk about before we wrap this up?
I don't think so. Thank you for having me.
Yeah, fantastic. Thank you so much, Carly. And again, make your donations one more time, 800-853-6889. That's 800-853-6889. Or text CMN Kids to 51555. If you want to make a donation online, you can make it at gundersonhealth.org/radiothon or go to any of the radio stations' websites to make your online donation for the CMN Radiothon.